In the national best-selling book, The World is Flat, A Brief History of the 21st Century by Thomas L. Friedman, the world is viewed as a level playing field in terms of commerce, where all competitors have an equal opportunity. In today's world, geographical boundaries are becoming increasingly irrelevant. Thus, to stay competitive in a global market, companies and individuals must change their perceptions of the world. In healthcare, perceptions are already changing, and this is described in the article Medical Tourism, Globalization of the Healthcare Marketplace by Horowitz and colleagues. Medical tourism, as defined in this article, is when citizens of highly developed nations bypass medical services offered in their own communities and travel to less developed areas of the world for medical care. In 2007, it is estimated that 750,000 Americans traveled abroad for medical services, and this number is expected to reach 10 million by 2010. The global medical tourism industry currently generates annual revenues up to $60 billion with a 20% annual growth rate. Many countries are competing for patients by offering a wide variety of medical, surgical, and dental services. These services are performed in modern facilities with advanced technology and attractive accommodations. A significant number of the physicians in medical tourism destinations received their training in industrialized nations, have specialty degree certification, and may have practiced in the country where they completed their training. Medical tourists are traveling abroad for a wide range of procedures, including cosmetic surgery, dental procedures, bariatric surgery, assisted reproductive technology, ophthalmologic care, orthopedic surgery, cardiac surgery, and even organ transplantation. Horowitz and colleagues report the primary reason patients from highly industrialized nations receive medical services in less developed countries is an attractively low cost. A savings of 50 to 80% can often be realized, with India providing medical services for prices as low as 10% of those in the United States. A typical medical tourist from the United States is a middle-class adult requiring an elective surgical procedure who is uninsured or underinsured. These patients have been described as middle-income Americans evading impoverishment by expensive, medically necessary operations. Another group of Americans pursuing medical tourism are those seeking cosmetic surgery, dental reconstruction, fertility treatment, and other treatments not covered by health insurance. The common feature in both groups is they can afford much needed or desired health care in low-cost medical tourism countries, but cannot afford it in their own community. In countries such as Canada and the United Kingdom, where a governmental healthcare system controls access to medical services, people are choosing medical tourism to avoid delays associated with long waiting lists. Additionally, these programs often do not cover cosmetic surgery or similar types of medical care. Therefore, patients from these countries pursue medical tourism for the same economic reasons as those from the United States. Another reason people seek medical care in destination countries is to receive services not available in their own community, such as stem cell therapy, which in America is also burdened with significant political and social controversy. Horowitz and colleagues report the main reason less developed countries can provide inexpensive healthcare is directly related to the nation's economic status, with prices reflecting population income levels. Low administrative and legal expenses also contribute to the affordability of offshore medical care. With so many countries catering to the medical tourist, many may find it difficult to navigate through the maze of identifying which hospitals have the most modern facilities, best physicians, and offer the highest quality of care. Medical tourism agencies have been established to assist patients with the decision-making process. Accreditation by the Joint Commission International, which has accredited over 200 hospitals in 24 countries, may provide a useful point of reference for patients selecting offshore medical facilities. Horowitz and colleagues point out that health issues have been raised regarding complications associated with travel and vacation activities in the postoperative period. The management of postoperative complications that may occur after a patient returns from abroad and the subsequent cost of this care are issues that are still unsettled. Not only has the medical community in developed countries recognized medical tourism as a real phenomenon, but insurance companies have noticed as well, and they are becoming active participants in the global healthcare market. Horowitz and colleagues identified medical tourism as a means of reducing the number of patients on waiting lists in countries that have limited capacity for certain procedures. These authors also note the future possibility of utilizing medical tourism as an opportunity to provide care for unfunded, low-income patients while simultaneously relieving the burden on domestic healthcare facilities and charity organizations. The medical tourism industry is fueled and driven by patients who feel disenfranchised by the healthcare system in their home country. Horowitz and colleagues report the flight of Americans to foreign destinations for life-saving operations is a symptom of an affordability problem that is symbolically important and must be addressed by leaders in healthcare. Medical tourism reflects the will of Americans and all consumers of healthcare to search for providers who offer maximal value. Medical tourism is changing the landscape of healthcare in several countries throughout the world, and all signs suggest this movement will continue to evolve. As it evolves, more and more questions about medical tourism are likely to be asked not only by patients, but by healthcare providers as well. Currently, research-based evidence is not available to answer these questions. The medical community needs data-driven research on medical tourism to appropriately care for patients and lead them in the right direction. Research is also necessary to influence policymakers who are responsible for making well-informed healthcare decisions, and it is one way to achieve the goal of our administration, which is to protect the safety and promote the prosperity of all Americans.